To scene.
Good morning.
Good morning.
My name is Gabrielle. I'll be your nurse for the day. Do you mind telling me your name?
Anna Kay,
And your birth date?
on November 15th of 1953.
Perfect. Thank you. I'm checking the bed breaks and it matches the information she gave me matches with the wristband. I'm checking her turgor, her cap refill for her circulation, and since she was able to respond, I know that her ABCs are fine. I have a silly question. Do you know where you are right now?
The hospital.
Perfect. And do you know what month it is?
January.
Excellent. That lets me know that let me know that she is oriented to time, place, and person. Now I'm here to do a few assessments on you, just following your operation from yesterday. Before we get started, I want to make sure you're not in too much pain. Are you in any pain right now?
A little bit.
All right, I'm gonna roll the dice to find out what your pain skin is. And you are in an 8 out of 10 pain. My goodness, that must feel awful. Can you tell me where it is?
It's in my knee.
In your knee? Does it move?
No.
All right. Can you describe the pain in any way?
It's achy and it hurts all the time.
All the time? I'm so sorry you've been waiting here for so long. I'm going to get you some pain medication. I'm going to get you 1 milligram of hydromorphone IV because it'll kick in super fast. It'll be within 15 minutes, and I'll also give you 1,000 milligrams of acetaminophen to tide you over.
Okay.
All right. And now that you're without pain, I'm going to do some vitals on you. I'm going to raise your bed. I'm going to take your temperature. Just open wide. Thank you. It's 37 degrees Celsius. Now I'm going to take your blood pressure. You might feel some uncomfortable squeezing. If it's absolutely unbearable, let me know and we'll stop.
Okay.
Right. And it is 120/80, which is absolutely perfect. And I'm going to listen to your apical pulse for a full minute. And it is 60 beats per minute, absolutely perfect. And I'm going to check your respirations. It's 15 rests per minute, which is perfect. And now your pulse oximeter. %on room air. And that is excellent. Thank you so much. All right. And now I'm actually just going to listen to your lungs. And I'm going to get a handy dandy volunteer. All right, and I've sanitized the bell. And I'm going to go, please breathe in deeply. And whenever you're able, you can breathe in again. Thank you, and I'm going to go down. deeply. In. Thank you. And in again. Thank you. You're doing excellent. Perfect, thank you. She does have COPD, so there were some wheezes, but that's normal given her medical diagnosis. And now I'm going to assess your abdomen, but before we start poking and prodding at you, have you gone pee yet?
Yep, about half an hour ago.
Perfect, and have you had to get up a lot, or have you had to go pee a lot, or have you had a lot of urgency?
No, just the once. I really had to go.
Perfect. And have you been passing any gas?
A little.
A little? All right. That's good. Now I'm gonna, do you mind if I just pull up your gown?
Sure.
Thank you. All right, and I'm inspecting for any distension or anything protruding, but it looks just fine to me. And now I'm going to auscultate all 4 quadrants, and I'm expecting hypoactive bowel sounds, considering she had high dose spinal anesthesia, and she's an older adult, so it might take her a little bit longer for the medication to be eliminated. And she does have hypoactive bowel sounds, but there's bowel sounds, and that's what I want to hear. And now I'm going to palpate your abdomen. And it's soft, non-distended, and that is perfect. So now I'm going to feel for your pedal pulses. I'm going to go between the toes. And they are even. And now I'm going to do a sensation test. I'm not going to let the patient know that I'm going to, with what I'm going to be assessing. I'm gonna ask the patient to look up at the ceiling and just let me know when she feels something dull.
Right there.
You feel something there?
Mm-hmm.
Perfect. And again?
Right there.
Perfect. Now I'm gonna break the tongue depressor in half. That'll work, and I'm gonna do it again. Let me know when you feel something. And if you can, describe it.
Oh yeah. It's like something between my legs.
Yeah, all right. And again.
Oh, there it is again.
Perfect, thank you. I just have one more thing to do. Let me know when you feel something again.
Oh, yep. Right there.
And what does it feel like?
Cold.
Perfect. And again.
Right there.
Perfect. And what does it feel like?
Chilly.
Perfect, thank you. All right. And now I'm I'm gonna just get you to try and point your toes forward like a ballerina. And obviously in practice, I wouldn't be doing the passive range of motion. Just let her what she can, and now flex it towards you. Point your toes to your face. Perfect. And now the other one. Pointed like a ballerina and then up towards your head. That is excellent, thank you. And now I'm going to take a look at your incision. And I'm not going to remove the dressing, but I'm just seeing if there's any excessive drainage. And I'm assessing the Jackson Pratt drain. There is about 25 cc's in there, and given how long it's been there, that's normal. It's the right color, and it's exactly what I'm looking for. And I'm not noticing any excessive drainage or redness around the dressing, and that's exactly what I'm looking for. So thank you. Now I'm just gonna double check and look at the IV, and it is totally full, not expired, and flowing well at the correct drip rate. And now, Mrs. Perry, I'd like to do some teaching with you. Have you heard, has anyone spoken to you about this little doohickey?
I've seen it over there, but nobody's telling me about it.
All right, well, we call it an incentive spirometer. What you do is you take a deep breath in, and then you blow out, and you try to get the ball to stay at that happy phase. You don't want to blow too much air. You also don't want to blow in not enough. Right at you want to keep the ball floating right at the happy place, because that is what the doctor has prescribed for you. It'll help prevent pneumonia, and so you won't have to, and so it'll prevent a longer hospital stay. It'll help expand your lungs. And I also wanted to talk to you about deep breathing and coughing. Has anybody talked to you about that?
No, what am I supposed to do?
Well, about once every hour or so while you're awake. You don't have to wake up in the night to do this, but I want you to breathe in deeply through your nose and hold for 3 to 5 seconds, and then breathe out as if there's a straw in your mouth.
Okay.
I know that you have COPD, so you probably have had some teaching about pursed lip breathing before, and that's exactly what you want to do. I'm sure you'll be a pro at it, but we will come in every hour or so and help you do that about 10 times in a row every hour.
Okay.
And because you don't have sensation to your feet yet, we won't let you get up and walk around just yet, but we'll keep doing our assessments, and as soon as you are able to feel your feet, we'll help you walk around, and then we'll let your feet dangle, so to prevent orthostatic hypotension. And if you need anything at all, your pop out is right in your hand. And yeah, so I hope you weren't waiting in pain for a long time this morning. Oh, good. If you ever feel 8 out of 10 pain again, or if you ever feel that the pain is getting worse, you let us know right away. Okay. And we don't want you to be in pain. Thank you so much.
Thank you.